Okay, we have all doom scrolled before, but how does doom scrolling impact our mental health? Dr. Shahrzad Jalali joining us live this morning, a clinical psychologist and trauma expert. She's here to discuss practical strategies to help break that cycle. Good morning to you.
Good morning.
Yes, thank you for joining us. Let's talk about, what exactly happens to our nervous system when we are constantly consuming distressing news or doom scrolling.
When we are kind of streaming all the time or taking in all these distressing headlines, our nervous system perceives each story as a potential threat. It doesn't know the difference between reading about danger and being in it. So we get stuck in this fight, flight, or freeze, chronic anxiety, dysregulation. Over time, this can lead to fatigue, irritability, poor sleep, and even physical symptoms like headaches and digestive issues.
Yeah, so it can really impact our bodies. Then why do we find it so hard to stop doom scrolling even when we know it's having negative effects on us?
That's a great question. Our brains are wired to scan for danger. It's a survival instinct. We believe if we just read one more article, we will feel a little bit more in control. But in actuality, it creates a loop. More stress leads to more scrolling, and then it leads to, again, more stress. Uh, but our brain kind of perceives it as it would any other addiction because it's a dopamine loop. So we get stuck in it.
Yeah, no one wants to get stuck in the loop. So how can people tell the difference then between, just staying informed and being emotionally overwhelmed?
Well, if the news leaves you feeling helpless, angry, or paralyzed rather than empowered to act, then that's, kind of your segue into approaching it in a different way. Checking the news compulsively is one way that we know we are kind of stuck in this, or having trouble sleeping at night because we are continuously thinking about it. So, what we have to do is set good boundaries with our consumption. So, we choose 2 specific times per day that we do this, and we use trusted sources to get information, and we do something nourishing for our nervous system every time after we consume some form of either reading the news or listening to the news. Is something like listening to a good piece of music, or going outside, taking a few deep breaths, something that calms us down after.
Yeah, it sounds like you need to find a counterbalance to it all. In your clinical experience, how has the rise of the 24/7 digital news cycle, impacted your patients' mental health? And again, how can we better protect ourselves overall?
That's a great question. So it's created what I call ambient trauma, a constant background kind of hum of distress. Patients are usually complaining about anxiety, hopelessness, and a lot of emotional exhaustion. It's a form of digital overwhelm. And as I have pointed out in my recent book, The Fire That Makes Us, any kind of trauma, when we're exposed to it over a long period of time, can kind of leave us in a very exhausted state of mind where we think we're normally functioning, but in reality, we are not. So the antidote isn't avoidance, it's intention. We need to consciously think about what we're consuming and reconnect to our bodies after we do so.
Yes, be proactive, it sounds like. Thank you so much, Dr. Jalali, for your expertise. We appreciate your time.
My pleasure. Thank you for having me.